Hi, my name is Robin, and I'm a registered dental hygienist at Aesthetic and Implant Dentistry. A regular cleaning is a healthy mouth cleaning, so it's called a prophy. Somebody is coming in regularly, they're on a consistent recare schedule, so that means just about every 6 months for a healthy mouth cleaning. They don't have a lot of disease, they don't have a lot of bleeding, they don't have a lot of biofilm buildup, tartar buildup. It's pretty straightforward. A periodontal cleaning is where the patient might have disease, they have bleeding, they have bone loss. It's a completely different cleaning. I assure them that it's manageable because it is. It's a disease that's managed. So it's managed by consistent recare, coming to get your teeth cleaned regularly, your home care at home. It's not something that's necessarily devastating, or it doesn't mean that you're gonna lose all your teeth. It's just a disease that needs to be managed, and we can help the patient do that, and I just assure them that together we'll get it done.